Thank you, Governor. Good afternoon, everyone. As always, thank you for being with us this afternoon for the very important updates that have been shared. I'll start with the numbers for today and from the weekend. In terms of the numbers for today, we have 16 new cases to report. Our total number of positive cases rose by 107 since our last update on Friday, because in addition to these 16 new cases, our new cases for Saturday and Sunday were 60 and 31, respectively. There are 73 people currently hospitalized across the state. 15 people are in the intensive care unit across the state, and 14 of those 15 in the ICUs are on a ventilator. We have 6 new COVID-19 associated fatalities to report today. This is in addition to the 6 that were confirmed for Saturday and the 7 that were confirmed for Sunday. In total, 3 people were in their 70s, 9 people were in their 80s, 6 people were in their 90s, and 1 person was older than 100 years old. Our deepest sympathies and prayers continue to be with the families of these Rhode Islanders who we have lost. On a more positive note, I did want to provide an update on the patient who I spoke about on Friday, who had been diagnosed with multisystem inflammatory syndrome in children. That patient was discharged from the hospital yesterday in good condition. We're grateful for that piece of good news. Next, I want to talk briefly about 2 additional issues: masks and quarantining. Wearing a mask or a cloth face covering, as the governor has shared, is enormously important. As we learn more and more about COVID-19, it is becoming clearer and clearer that a simple face covering prevents transmission of the virus, and for that reason, it saves lives. The governor already shared the essential experiment that we learned from when a number of large gatherings related to the protests had occurred in early June, many of them attended by thousands of people. To be clear, that was a risk and one that we do not recommend. The good news, however, is that the majority of the people at these events were wearing masks, and that's with huge thanks to the people who already came wearing the masks, as well as those who joined with us from the Department of Health to be there to hand out thousands of masks. That approach was effective. The result of this has been that we haven't seen any spikes in cases connected to those events. Our positivity rate for people being tested after attending a large gathering has been lower than 1%. This is important news. However, I do want to add that masks and facial coverings are only effective if they are worn properly. A mask that is down around your chin and not covering your nose or your mouth is absolutely still not protecting the people around you. You need to be able to cover both your nose and your mouth completely. If you're headed out, bring your mask. If you're going to be around other people, wear your mask and make sure that it covers your nose and mouth fully. We have worked with Rhode Island Emergency Management Agency and our Rhode Island Health Equity Zones to get hundreds and thousands of masks into the communities in Rhode Island that are hardest hit. We are continuing to be aggressive in advancing that. We have made requests for millions of masks, a couple of million to be able to cover the entire population. We have received that, and we are now going to work with partners throughout the state, from communities across the state, to help ensure that everyone has some form of face cloth covering in hand. We really want to focus on having those coverings in place for everyone, especially people in their 20s and 30s, those who may not feel like it's necessary because they don't have symptoms or they're not feeling sick or that they would end up in the hospital. But as we've said, it is critical for everyone to be wearing it. What other states are seeing and what we have the ability to prevent against right now is the 20-something effect. People in their 20s in other states have been going to bars, going to beaches, going to house parties, all without wearing masks and without taking other precautions like distancing, like washing your hands frequently. The consequences that those states have seen are spikes in cases. Many states can also attribute protests where people weren't wearing masks to spikes in cases. We have the evidence that the governor has shared, and we want to continue to reiterate, and now also have the tools to push out to you that we'll be working on through this week to ensure that people have the items that make the difference. When we say follow the rules, they are simple. It's wearing this cloth face covering and keeping the distance. We have seen some of the increases in Rhode Island based on the data that was shared among our 20-something-year-olds. Earlier in previous weeks, those in their 20s made up 10 or 11% of cases. More recently, those in their 20s are making up 20% of cases. We need young adults to join with us in acting responsibly and taking the measures to prevent the spread of disease. Wearing your face cloth covering or mask, not sharing food and drinks, washing your hands regularly, and maintaining the 6 feet distancing. The entire state of Rhode Island has been making sacrifices, and most young people have been making sacrifices too. We want to acknowledge that and celebrate that. And what we want now is for everyone to join in supporting the small groups of young people who still have some room for improvements, to step up and to make adjustments. These simple changes will make a difference. I also want to talk for a quick moment about quarantining. If someone returns back to Rhode Island from traveling, they still need to monitor for symptoms and quarantine. The key is continuing to see how you are doing. As the governor has shared, we have an exception now that will make it so that you can sign up for an asymptomatic test by going to portal.ri.gov. But for most people, that effort of quarantining, staying local, staying near home, monitoring for symptoms is going to be the best way to prevent the spread of illness and to keep the people in your community safe. So we want people to have options, and we want you to remain informed about what will work best.